My name is Ayo Otubanjo. I am the CEO of Vinci Hair Clinic. I'm responsible for the Africa region, but I'm also a partner in the Vinci International Group, which is a global medical group. Vinci Hair Clinic is a global leading hair restoration clinic. So basically what we specialize in is the restoration of hair. So if people are going bald, we help them to recover the hair. The business has been around nearly 20 years. We're primarily based in the UK. We have about 28 clinics in about 14 countries. The Nigerian operation was set up about 5 years ago, and the Lagos clinic, which is our flagship clinic, was set up then. But since then, we've opened new clinics in Abuja and another one recently in Accra in Ghana. I think I always go back to our global CEO who started going bald at a very early age and was traumatized, shall I say, about the experience. And he was looking for all manners of solutions to his baldness, and decided that I needed to do something for other people who are facing similar situations. So I guess the inspiration came from him, being a young man, losing his hair at a very early age. Africans, like every other race of people on the earth, suffer from hair loss. The problem is, up till the point we came to Nigeria, there has been no solution that can be offered to anybody. So most people who go bald just shrug their shoulders and say, well, it's a fact of life. They get used to it, they go on with it, and try and make the most of their lives as best as they can. But it doesn't have to be like that. It doesn't have to be like that. Everywhere in Europe, in the US, in the Middle East, people are doing something about their baldness, because now that we're in the age of Instagram, where image and your photograph and your looks, it's all the rage. You've got to look, for a solution to any hair loss issues you're having. So, we're here to provide a service, and people are very pleased that we're here. Hair loss, our alopecia, which is the technical terms, there's so many different types of alopecia. Without going into the details of each one of them, the ones that we come across frequently in the Nigerian and the Ghanaian clinics, what we call traction alopecia, which is the loss of hair, and it usually affects women, by the way. So that's the loss of hair in the fringe. It's usually caused by a lot of things they do at the salon. When they go to the salon, tight braiding, using glues to fix hair and stuff like that. The other type of alopecia we see regularly is androgenetic alopecia, which is the typical pattern baldness. Now that affects men and women as well. So I think research has shown that maybe up to about 60% of men would suffer from that particular type of hair loss at some stage in their lives. And I think about 40% as well of women would experience a similar loss of hair by the time they get to menopause. So, those are the two primary types of alopecia we see. We see other types, but they're not very frequent, Traction alopecia can certainly be avoided. It's all about educating people, about things they should avoid doing when they go to the salon. So for instance, I always say to people, why do you have to have such tight braiding? To the extent that you start getting a headache, after the session, because it damages your follicles, and then those are the roots of your hair. Why do you get someone to put a glue which you have no provenance, or there's no provenance of, to apply it on your scalp, just to fix a nice looking hairpiece? And 6 months later, you develop a serious reaction to it, and you start losing your hair. I mean, the sensible things about not just allowing any salon worker to apply stuff on your scalp without looking at the product they're using and seeing whether that product's been certified for use on the human body, certified by the likes of NAFDAC in Nigeria, or maybe if it's made in the US by the FDA. Very simple precautions can be taken. With regards to androgenetic alopecia, which is the pattern baldness, I mean, similarly, once you start noticing that your hair fibers start thinning or getting soft, like baby's hair, usually in this part of the scalp, now that's a sign that you're about to start losing your hair. And if you come in to us at that stage, we can actually stop it. So, the myth about you can't prevent baldness is totally false. It's a myth, exactly that. Well, there's a wide array of treatment options. So it's all dependent on the particular type of alopecia, when you come into us, and how much hair loss you've experienced. So we have stuff like medication, which is usually very effective, especially when somebody is just starting, to lose their hair. They haven't actually lost it, they're just starting the process. So medication can be a very useful and very effective tool. And then you move along the spectrum, you have some therapies that we deploy in the clinic, such as mesotherapy, which is injecting pharmaceutical drugs directly into the scalp. And we also have a therapy called platelet-rich plasma therapy, which is a means of using the cells to repair, using your blood or the byproduct of your blood to repair the cells, damaged cells. And then you've got cosmetic procedures such as microscopigmentation, which is usually very effective for the camouflage of baldness, especially men that have already gone bald. And at the very end of the spectrum, you have the hair transplant, which is the hallmark of hair restoration, because it's a guaranteed form of hair restoration. So we do all that in our clinic in Lagos. Well, I mean, hair transplant is perhaps the current rage, in the sense that that's what most people opt for when it comes to hair restoration. But there's the latest development is stem cell therapy, which is still very much in the experimental stage. And we feel that that will revolutionize hair restoration, because currently, the more extensive your baldness, the less likely you are to be a good candidate for a transplant. All because, we need to get the donor follicles from yourself. So the more donor follicles we need, to implant, the more we have to get from yourself. So the equation doesn't work. So there's some people who are so extensively bald that a transplant currently would not be a good option for them. What stem cell therapy does, it totally changes the equation. So it doesn't matter even if you're totally bald. Just one tiny little cell, maybe hair, can be extracted using a punch biopsy, and then that is then replicated several times to produce thousands of follicles. So the idea of oh, I'm so bald I can't have hair transplant would no longer be a problem. But like I said, it's still very much in the experimental stage. Only the Italians and the Americans are really spending money to do the research, and hopefully they'll get us to a point where it will become freely available to everybody. The vast majority of the stuff we need are actually brought in from the UK or from the US. We still encourage people to come in. We've been trying as much as possible to see how we can offer discounts to people, and we're also encouraging people to pay instrumentally. So if somebody's looking to have a procedure perhaps in 3-6 months time, they could start making small payments towards that over that period. So by the time it comes to when they want to have the procedure, they would have effectively paid for that procedure.